Urinary catheter insertion. It's one of those clinical procedures you'll see all the time, but it's also one where the stakes are incredibly high. It's this delicate dance between technical skill, super strict sterility, and just genuine patient care. So let's dive in and break down how you can master it. So, why do we say preparation is half the battle here? Well, it's because success, safety, and your patient's comfort, those aren't decided when the catheter goes in. Nope. They're decided by all the groundwork you lay long before that catheter even leaves its package. All right, let's get into our first section, purpose and preparation. Think of this as the foundational knowledge you absolutely need before you even think about touching your supplies. So first things first, why are we even doing this? Well, the most obvious reason is to drain a bladder that's blocked or retaining urine. But it's also a really critical tool when we need to measure urine output with pinpoint accuracy, what we call strict I's and O's for intake and output. This is absolutely vital for monitoring kidney function in really sick patients. Before you do anything, you've got to play detective. Seriously, this assessment is non-negotiable. First, confirm the indication. Is this actually medically necessary? Then, ask about any previous catheterizations. Did they have any trouble? That can clue you into potential issues. And this is a big one. Check for allergies. We're talking latex, iodine, even the adhesives used to secure the device. Any of those can cause a serious reaction. Okay, now let's shift gears and focus on the patient. Your communication here is just as important as your technical skill. Walk them through the steps, let them know what to expect, that they'll feel some pressure, but it's often followed by a sense of relief. And guaranteeing their privacy isn't just a nice thing to do, it's essential for building trust. And that trust helps reduce their anxiety, which makes the whole process smoother for everyone. With that foundation solidly in place, let's move on to our next section, setting up both our patient and our supplies. All right, let's talk about your toolkit. You're going to need clean gloves for the initial prep and 2 pairs of sterile gloves. Why 2? It's a fantastic habit. In case your first pair gets contaminated, you've got a backup ready to go. You'll also need a washcloth, a waterproof pad for the bed, and of course that all-in-one sterile Foley kit. Having everything ready and within reach is key. Here we go with the initial patient prep. First, always confirm the provider's order and get consent. Next, check 2 patient identifiers, usually name and date of birth. Then, provide privacy, introduce yourself, and perform hand hygiene. Finally, you'll help the patient get positioned comfortably on their back with their knees flexed to give you good access. Okay, deep breath. This brings us to the main event, the sterile insertion itself. Don't worry, we're going to break this down into clear, totally manageable phases. From this moment on, sterility is the name of the game. Everything you do is about protecting that sterile field. You'll carefully open the kit, using the outer wrapper as your sterile field. Then you'll slide that sterile drape underneath them. Only after all that is set up do you put on your sterile gloves. This is your clean workspace. Protect it. Now, inside your sterile field, it's time to prep your equipment. Get everything organized so it's easy to grab. Take the plastic sheath off the catheter, squirt your lubricant into the tray, and here's a step you can't forget. Attach that pre-filled saline syringe and test the balloon. You need to know that it inflates and deflates properly before it's inside the patient. Trust me on this one. Okay, this next part is a really, really critical concept. Your non-dominant hand is now going to touch the patient to expose the urethra. As soon as it does, that hand is considered dirty. It does not touch anything sterile again, period. Your dominant hand remains sterile and does all the cleaning. Using the forceps, you'll perform 3 distinct cleaning strokes, always moving from front to back away from the opening. And this image here gives you a perfect visual of that cleaning path. See how the motion is always away from the urethra? That's how you prevent contamination. The most important rule here is simple. 1 swipe, 1 cotton ball. Never ever reuse a cotton ball. It's a simple habit, but it's one of the best ways to prevent a nasty urinary tract infection. Okay, you're all prepped. With your sterile dominant hand, you'll pick up that lubricated catheter and gently insert it. You'll keep advancing it until you see that little flash of urine in the tubing. That's your confirmation that you've hit the bladder. But don't stop there. This is so important. Once you see urine, you have to keep advancing it another 2 to 3 inches. This ensures the balloon will be inflated fully inside the bladder and not in the urethra, which could cause a pretty serious injury. All right, we are on the home stretch now. Let's move on and talk about finalizing the procedure to make sure our patient is both comfortable and safe. So once that catheter is in position, you're going to inflate the balloon with the entire syringe of saline. That's what anchors it inside the bladder. Then give a very gentle tug on the catheter.
You should feel a little resistance. That's how you know the balloon is seated correctly. Finally, you'll secure the tubing to the patient's thigh with the holder. This is super important to prevent pulling and accidental removal. Now, I want you to burn this number into your brain, 1,000 milliliters. This is a huge safety threshold. If you drain more than 1,000 mLs of urine really fast from a bladder that was super full, you need to clamp the tubing for a bit. Why? Because that rapid pressure change can actually cause the patient's blood pressure to drop dangerously. It's a key point that can prevent a serious complication. We're just about done. Now, you'll attach the drainage bag to a part of the bed frame that doesn't move, never the side rail, and it has to be below the level of the bladder. Gravity is your friend here. Make sure there are no kinks or big loops in the tubing where urine can get stuck. Then it's time to clean up, dispose of your materials, and perform hand hygiene one last time. Finally, let's cover the essential follow-through. This is all about understanding the risks you've been working so hard to prevent and, of course, documenting your work properly. When you boil it all down, this entire procedure is a balancing act between two major risks. On one side, you have infection. Any little break in that sterile technique can lead to a UTI. And on the other side, you've got the risk of physical injury from improper technique. Literally every single step we've talked about is designed to keep that scale tipped perfectly in favor of the patient's safety. You've heard it a million times. If you didn't document it, it didn't happen. Your note needs to be precise. You've got to include the date and time, the reason for the catheter, and the size you used. And be honest, how many attempts did it take? Then describe the urine, the amount you got out, its color, any odor. And finally, how did the patient handle it? This paints the full picture for the next person taking care of them. And hey, one last important tip for you. Catheters are not one size fits all. They come in a whole range of sizes, measured in French. And remember, a smaller number means a smaller diameter. Always, always check your hospital's policy and the provider's specific order. So, we end right where we started. The steps, the technique, the sterile field, that's the science of it all. But the communication, the reassurance, protecting someone's dignity, that's the art. True mastery isn't just about getting the catheter in. It's about caring for the